A neck lift is a surgical procedure aimed at rejuvenating and tightening an aging neck. This particular procedure can be combined with other operations at the same time, such as a facelift, and quite often we'll find that if someone needs a neck lift, chances are they probably do need a facelift as well, and that can be assessed during the consultation. A neck lift can have an adjunct in the form of a liposuction, which again helps to remove the excess fat in the neck so that it's sort of more streamlined, better contoured, and then once tightened, provides a really nice, youthful appearance.
As we get a little bit older, the skin around the neck tends to sag a little bit. The muscle can become a little bit more further apart, and often patients would come in and having little bands or little cords down the neck. The benefits of a neck lift is that it improves the appearance of the neck. It gives you a better jawline. It gives you less fullness around the neck. When is the right time for having a facelift? Well, I think there's usually no right time because it all depends on the function and aesthetics and the needs of the patient. While as we get older, the skin sags and the tissues sag, and that may mean that we would want to have a neck lift for aesthetic reasons. There are other situations where patients have a big neck, a fatty neck that can impair on their breathing. So therefore, to alleviate these problems, a neck lift in a selected amount of patient can be done at an earlier stage. If it's done on its own, typically there'll be a cut or an incision beneath the chin area where we try to address the elements in the neck. This may involve liposuction, plicating or stitching up the muscles that have gone apart, or sometimes excising some of the tissues. After a neck lift, patients normally stay in hospital for one night and go home the next day. They normally have a couple of drains that come out after a few days. We would have some sutures that will need to come out after a week. And typically we tell patients to not to do any strenuous exercises for a good 6 to 8 weeks.
The result of a neck lift can be a long-lasting one, but it will depend on how the patient looks after their skin and their health.
A good candidate for a neck lift is somebody who understands what the surgery involves and what are the limitations. A good candidate would be somebody who has excess fat in the middle area. A good candidate is somebody who has the muscles that have been stretched apart a little bit that can be easily be put back. And a good candidate is somebody who has good quality skin, which would normally retract as after the surgery.
Should you wish to discuss any aesthetic or reconstructive procedure with us, please get in touch.